when I think about the many options that I could have chosen in the medical field, nursing wasn't really one of them in my beginnings. I went to school here at Eastern Oregon University, and my roommate was a nurse, or was in the nursing program. As I'm listening to her go through her classes with her classmates and what they're doing, and so that looked like something I wanted to do. I did it, I got in, and that's how I started. Got my bachelor's here, and that's how I started in medicine, was right here in Eastern Oregon. The most rewarding part is that I'm serving those people that served me. They gave me support as I was going through school. They came to the gym, they came to my programs, they came to Eastern Oregon University and followed me when I was playing here. So I see them, I'm part of them, I am them. There's not a real difference between Jamie Jo growing up and Jamie Jo nurse practitioner, and I think I get some of that in my relationships that I have with my patients. Some of that is also the most difficult. Not everybody wants to come and tell their story to the person that they grew up with, the person that they might have had as their flower girl in their wedding. I mean, some of those relationships are a struggle. Once they come in and figure out that, this is Jamie Jo medicine and there's Jamie Jo community member, that's easier. But also it's those community members as they get older and frail and go through the process of death and dying. As their provider, that's really tough. As a community member, that's just as tough. Yeah. And then taking care of the rest of what falls out afterwards is tough. You can make me cry. The thing I love about doing rural medicine is that I'm literally taking care of entire family units. I am taking care of grandpa, I'm taking care of grandma, I am taking care of grandbaby, newborn. I see that whole entire dynamic, who's related to who. It's wonderful to do that, and it sometimes is very confusing to some of my staff. It takes a lot to learn that basis of who's related to who, but I love it. I mean, it's not just rural medicine, it's family medicine, and it's more than just family medicine, I guess. It's part of that community piece to it. Grandma Rose was probably the main reason that I became a nurse practitioner, and that is because she grew up here, had, one or two family practice doctors her whole life. She was 97 when she passed away. The last 10 years, she had a fairly high turnover of providers, so she had to tell her story over and over and over to the new providers, and that was when I was in that. I was a nurse for 8 years, living in Boise, thinking, well, if I was going to come home, what do I bring home that I can continue to do? I was in surgical services, so I had to make a change unless I wanted to live close to the hospital. So, seeing grandma have to tell that story, and it got harder and harder the older she got. Mom and Aunt Carrie had to help out in that story. So I wanted to be that piece that was steady. Yeah, here for the long run. And my patients ask me that. They come to me going, well, I know you built your house. I know you're from here. You're not going to leave me. And that's important.